Welcome, everyone. I'm glad you're here today. We're about to explore some important concepts in pharmacy ethics. The title of our presentation is Ethical Principles, and we'll be discussing what they are and why they matter. We'll also look at how these principles guide pharmacists in their daily practice, especially their obligation to care for patients. So, let's get started and see how these common goals help shape ethical decision-making in pharmacy. Today, I want to talk about the purpose behind these principles. First, they help us determine the rights of patients, what they are entitled to, and what protections they should have. Second, they guide us in making decisions about our duties as pharmacists, making sure those duties align with patient rights. Third, these principles allow us to justify our actions, whether to ourselves or others, by showing that what we do is grounded in these fundamental rights and responsibilities. Additionally, they provide clear guidance on what patient care commitments really entail for us as practitioners. Ultimately, understanding this purpose is key to ensuring that we practice ethically and responsibly, always putting patient well-being at the forefront. Let's talk about autonomy. This principle really emphasizes an individual's liberty of choice, action, and thought. It means that no one should interfere with a person's decision-making in these areas. In healthcare, this is especially important because patients have the right to refuse or choose their treatment. It's about respecting their ability to make decisions that align with their values and preferences. When we think about pharmacy law and ethics, autonomy reminds us that patients are the ultimate decision makers. They have the right to decide what treatments or medications they want, and our role is to support and respect those choices. This principle is fundamental because it underpins the trust and respect necessary in all healthcare relationships. Now, let's consider what will happen to their bodies. When it comes to health and treatment, individuals face important choices among competing options. They must decide what to take, what not to take, and how to manage their own health. Importantly, autonomous individuals are free to make these decisions as long as they don't infringe on the rights of others. This means that even if a choice seems unwise or foolish based on conventional wisdom, as long as it doesn't harm another person, it's generally their right to choose it. This principle highlights the core idea that personal autonomy is fundamental in pharmacy law and ethics. It emphasizes respecting individuals' rights to make their own health decisions, even when those decisions differ from what healthcare providers or society might expect. So, in the broader context of our discussion, understanding these rights helps us balance respecting personal freedom with ensuring safe and ethical practices in pharmacy. Let's talk about the concept of exception and medical paternalism. Medical paternalism is the idea that healthcare professionals, including pharmacists, because of their education and training, know what is best for their patients. Essentially, it's the belief that we, as professionals, can make decisions on behalf of our patients to protect their health and well-being. There are two main types of this paternalism. The first involves making decisions for patients when they are unable to make informed choices themselves, such as in emergency situations or when the patient is incapacitated. The second type is more about guiding or influencing patients' decisions, especially when their choices might not align with their best interests. Understanding these types helps us see how the balance of power and responsibility plays out in pharmacy law and ethics. It's important because, while our expertise is vital, we also need to respect patient autonomy and involve them in decisions whenever possible. This slide highlights the tension between professional authority and patient rights, which is a key theme in our overall discussion on pharmacy ethics. Now, let's talk about the concepts of paternalism, starting with weak paternalism. This occurs when the individual isn't fully autonomous, or when there's only a minimal need to intervene to determine whether they are truly autonomous. Essentially, it's about stepping in only when there's some doubt about their decision-making capacity. On the other hand, strong paternalism involves a more assertive approach. It's when we believe that the person is making the wrong decision or that their choice might lead to harm. In such cases, intervention is justified because we think we know what's best for them, even if they seem to be capable of making an autonomous decision. Understanding these distinctions is crucial in pharmacy law and ethics because it helps us navigate when and how to intervene in patient decisions, always balancing respect for autonomy with the need to protect individuals from harm. Let's consider an example to understand this better. Imagine a patient with terminal cancer who prefers to spend her remaining days without the medication that makes her feel constantly ill. She values her quality of life in those final moments. Now, contrast that with the physician's perspective. The doctor might believe that continuing the medication could prolong her life, and so they might try to persuade her and her family to stick with the treatment plan. This is where the key issue comes into play. The physician is using their authority to influence the patient's decision. In this case, it can be seen as a form of manipulation because the physician's recommendation is driven by what they believe is medically best, but it may override the patient's personal wishes. This example highlights an important ethical point in pharmacy law and ethics, balancing professional guidance with respecting patient autonomy. It underscores the need for us, as healthcare professionals, to be aware of how authority can impact patient choices and to ensure that our influence supports, rather than overrides, their values and preferences. Let's talk about informed consent. This is a fundamental rule in healthcare and pharmacy law. It means that patients need to be fully informed about what they're agreeing to before they participate in any medical action. That includes understanding both the benefits and the risks involved. For example, when someone participates in a clinical trial, takes a medication, or decides to have surgery, they should know what to expect. It's about making sure the patient has all the necessary information to make an informed choice. Informed consent isn't always formal. It can also be informal. Sometimes, it might be a simple conversation, but the core idea remains the same. Patients need to understand what they're agreeing to. This concept ties into our overall focus on ethics and legal responsibilities in pharmacy practice. Ensuring informed consent is key to respecting patient autonomy and promoting ethical standards in healthcare. Let's talk about the client's right to be informed and to freely choose a course of action. Essentially, this means that patients have the right to know what's involved in their treatment or procedure before they agree to it. For example, giving informed consent for a therapy or medical procedure is a key part of respecting their autonomy. This right is built on 5 essential elements: disclosure, understanding, voluntariness, competence, and consent. Disclosure means providing all the necessary information about the treatment, its benefits, risks, and alternatives. Understanding is about ensuring the patient truly comprehends that information. Voluntariness indicates that the decision must be made freely, without coercion or undue influence. Competence refers to the patient's ability to make informed decisions, meaning they have the mental capacity to understand and evaluate the information. And finally, consent is the patient's explicit agreement to proceed based on this understanding. These concepts are fundamental to pharmacy law and ethics because they protect patient rights and promote ethical practice. Remember, without clear disclosure and genuine understanding, the whole process of informed consent can be compromised. So, as healthcare providers, it's our responsibility to facilitate this process, ensuring patients are truly informed and free to make their own choices. Let's talk about confidentiality. This is the fundamental idea that what a patient tells a health professional is kept private. Essentially, it means that this information won't be shared with anyone else or any other institution without the patient's permission. It's all about protecting the patient's privacy and maintaining trust. Most medical information by nature is considered confidential. Of course, this holds true unless the patient specifically grants approval for its release. So, as healthcare professionals, we have a duty to keep this information private unless there's a clear, informed consent from the patient to share it. This concept is a cornerstone of pharmacy law and ethics because it helps build trust between patients and healthcare providers. When patients feel confident that their information is safe, they're more likely to be open and honest, which ultimately leads to better care. Remember, confidentiality isn't just a legal obligation. It's a moral one that supports the integrity of our profession and the well-being of those we serve. Let's talk about the individual's right to control their own information, specifically when it comes to giving or refusing consent to release privileged information. This is a fundamental aspect of patient autonomy and privacy. However, there are important exceptions to keep in mind. For instance, if withholding information could potentially harm others, or if the patient lacks the capacity or autonomy to make that decision, then the rules may change. It's crucial to understand that these exceptions are in place to protect public safety and ensure that vulnerable patients receive appropriate care. Throughout our discussion today, remember that respecting patient rights is central, but so is recognizing when the law allows us to act differently for the greater good. This balance is at the heart of pharmacy law and ethics. Let's talk about the principle of non-maleficence, which is often summarized as doing no harm. In the context of pharmacy, this means that we have a duty to avoid actions that could cause injury or harm to our patients. It's important to understand that non-maleficence isn't just about avoiding overt harm. It's also about the choices we make and the actions we take, or don't take, that could potentially hurt someone. For example, if a pharmacist chooses not to counsel a patient out of fear that providing information might lead the patient to stop a medication, that might seem compassionate on the surface. But in reality, it's actually respecting the principle of non-maleficence, because withholding information to prevent harm can itself cause harm, like the patient being unaware of side effects or proper usage. So, in essence, acting to protect the patient from harm sometimes involves difficult decisions, but always with the goal of ensuring we do no harm through our actions or omissions. This highlights the importance of ethical decision-making in pharmacy practice and how it ties into the broader theme of pharmacy law and ethics. Today, I want to talk about how the principle of non-maleficence guides pharmacy practice. Non-maleficence, of course, means do no harm, and it prohibits us from engaging in actions that could cause harm to patients. This includes both deliberate harmful actions and unintentional ones. For instance, deliberately substituting one generic drug for another without proper authorization or evidence of bioequivalence is a clear violation. Such actions can potentially harm the patient if the drugs are not truly interchangeable. On the other hand, non-maleficence also covers unintentional harm. For example, if we accidentally use the wrong SIG code, say, the one for take one tablet 4 times daily, when the prescription actually directs the patient to take only one tablet daily, that could lead to overmedication or adverse effects. In essence, our duty is to be vigilant and precise in our practice, ensuring that we avoid both intentional and accidental harm. This principle ties into the broader theme of pharmacy law and ethics, reminding us that patient safety is always our top priority. Harm can occur in many different ways in our line of work. Sometimes, it's caused by deliberate actions, which means someone intentionally does something that could harm others. Other times, harm happens because of incorrect actions, like neglect or ignorance, when we simply don't realize the impact of what we're doing or failing to do. And then there's harm through omission, which means we fail to prevent others from causing harm. It's important to remember that in pharmacy law and ethics, our responsibility goes beyond just our actions. It's also about what we prevent or fail to prevent. Staying vigilant helps us protect our patients and uphold the integrity of our profession. Let's talk about beneficence, which is all about doing good. This principle emphasizes that we should take positive actions to improve the well-being of others. Specifically, it involves 3 key aspects. First, preventing what is bad, so taking steps to avoid harm before it happens. Second, removing bad or evil, actively addressing and eliminating issues or harms that already exist. And third, doing or promoting good, encouraging positive outcomes and benefits. When we think about pharmacy law and ethics, beneficence guides us to prioritize patient care and safety at every turn. It reminds us that our actions should always aim to help and protect those we serve. Beneficence is all about acting in a way that does good for the patient. It means that as practitioners, We should always aim to serve the best interests of those we care for. This principle encourages us to prioritize the well-being of our patients in every decision we make. It's important to recognize that beneficence can be unintentionally violated through acts of omission. That's when we fail to act, perhaps by not providing necessary information or neglecting to follow up. That could harm the patient or compromise their care. Now, moving on to non-maleficence, which is closely related. This principle emphasizes taking due care to avoid causing harm. It's summed up nicely as first, do no harm. Essentially, before doing anything, we need to consider whether our actions might hurt the patient and act accordingly to prevent that. Both beneficence and non-maleficence guide us to act ethically, ensuring that our decisions always aim to benefit the patient and avoid unnecessary harm. These principles are fundamental to our role as healthcare providers and help us maintain trust and integrity in our practice. Let's take a moment to look at an example. Imagine a pharmacist who neglects to counsel patients about their medications. This might seem like a small oversight, but it actually violates a fundamental principle of pharmacy ethics: beneficence. Beneficence is all about doing good and acting in the best interest of the patient. When a pharmacist doesn't provide proper counseling, they're missing an opportunity to ensure the patient understands how to use their medications safely and effectively. By sharing important information, like dosage, potential side effects, or interactions, the pharmacist helps the patient use their medication correctly, which ultimately promotes better health outcomes. So, this example highlights how important it is for pharmacists to adhere not just to laws, but also to ethical principles that prioritize patient well-being. This connects to the broader theme of today's presentation: understanding the intersection of pharmacy law and ethics, and recognizing how ethical practices support legal responsibilities. When we act ethically, we reinforce trust and uphold the integrity of our profession. Fidelity, at its core, is about loyalty. It requires us as pharmacists to act in a way that truly demonstrates trustworthiness to our patients. This means keeping our promises and being reliable in every interaction. When we talk about fidelity, we're referring to the kind of bond or promise that forms between us and the people we serve. It's a fundamental part of building trust and ensuring that patients feel confident in the care we provide. Remember, this obligation isn't just about following rules. It's about fostering a professional relationship rooted in respect and integrity. So, in our overall role, fidelity is what helps us maintain that essential bond of trust with our patients, supporting their health and well-being. This slide highlights an important aspect of the professional relationship between pharmacists and patients. It emphasizes that pharmacists carry a significant responsibility, specifically, the burden of acting in the best interest of their patients. This means that, above all, our primary duty is to prioritize patient well-being and safety in every decision we make. Regardless of how long we've known a patient or the nature of our relationship, we have an ongoing obligation of fidelity. Fidelity means loyalty and faithfulness, so we must remain committed to serving our patients honestly and ethically at all times. This duty doesn't diminish with time or familiarity. It stays constant, ensuring that we always put the patient's needs first. This principle is central to pharmacy law and ethics, reinforcing the trust patients place in us. Ultimately, our goal is to uphold their health and safety, maintaining professionalism and integrity throughout every interaction. Let's continue with the next video to see how these concepts come together in action. As we move forward, remember that the key points we've discussed, such as the importance of strategic planning, innovative solutions, and effective execution, are all interconnected components of success. This final segment will reinforce how these elements can be applied practically in your own projects. So, stay tuned and keep these ideas in mind as we wrap up the presentation.